Hey ladies, welcome back to Healthy Her. Today we are talking about something that every single woman needs to know about. And I know this topic can feel scary, but I promise you, knowledge is power. The more you know, the better chance you have of protecting yourself. We are talking about breast cancer. Did you know that in the UK, 1 in 7 women will develop breast cancer in their lifetime? That is an incredibly high number. But here is the good news. When breast cancer is caught early, the survival rate is over 90%. So today, I am going to show you the early warning signs that every woman must know. Because catching it early could save your life. Please watch this video till the end and share it with every woman you love. Let's get started. Sign number 1, and the most well-known sign, is feeling a lump in your breast. Now, most lumps are not cancer. Most are completely harmless. But any new lump that you have never felt before needs to be checked by a doctor. So what does a cancerous lump feel like? Usually it feels hard, like a small stone or a pea under your skin. It often has irregular edges, meaning it doesn't feel smooth and round. And most importantly, it usually doesn't move when you press it. A harmless lump like a cyst usually feels softer and moves around when you touch it. Now where should you check? Check your entire breast, including up towards your armpit area, because breast tissue actually extends into your armpit and lumps can appear there too. The best time to check is a few days after your period ends, when your breasts are less tender and swollen. Ladies, please do this check every single month. It takes 5 minutes and it could save your life. If you feel anything new or unusual, don't wait, go to your GP straight away. In the UK, your GP must refer you to a specialist within 2 weeks if they suspect cancer. So please, do not delay. Sign number 2 is changes in the shape or size of your breast. Now, our breasts naturally change throughout the month because of our hormones. They can feel bigger or more tender before your period. That is completely normal. But what is not normal is if one breast suddenly becomes noticeably larger than the other, or if the shape of your breast changes, for example, it starts to look different from the other side. Or if you notice any unusual swelling that doesn't go away after your period. A lot of women ignore this because they think, oh, it's probably just hormones. But ladies, if you notice a persistent change in shape or size, especially on one side only, please get it checked. We all know our own bodies. If something feels or looks different, trust your instincts. Your body is trying to tell you something. Sign number 3 is something many women don't know about, and that is skin changes on the breast. So, what kind of skin changes should you look for? First, dimpling of the skin. This is when the skin on your breast starts to look like the skin of an orange, with small dents or puckering. This is called peau d'ange, which means orange skin in French, and it is a serious warning sign. Second, redness or rash on the breast skin. If the skin on your breast looks red, irritated, or has a rash that won't go away, this needs to be checked. Third, the skin feels warm to touch. Some types of breast cancer, especially inflammatory breast cancer, can make the breast feel warm or hot. Now, these skin changes can sometimes look like an infection or eczema. So many women, and even some doctors, can mistake them for something harmless. But if you have any of these skin changes on your breast, and they don't clear up within a week or 2, please insist on getting it properly checked. You know your body best. Always advocate for yourself.
Sign number 4 is nipple changes, and this is one that many women feel embarrassed to talk about. But it is so important, so let's talk about it openly. There are several nipple changes you should watch out for. First, nipple inversion. This is when your nipple suddenly turns inward when it was always pointing outward before. Now, some women naturally have inverted nipples from birth that is completely normal. But if your nipple suddenly changes direction, that is a warning sign. Second, nipple discharge. Any discharge from your nipple when you are not pregnant or breastfeeding needs to be investigated, especially if the discharge is bloody or coming from only one breast. Third, changes in the skin around the nipple. If the skin around your nipple, called the areola, becomes scaly, flaky, or crusty, This could be a sign of a rare type of breast cancer called Paget's disease. It often looks like eczema, so many women ignore it for months or even years. Ladies, please do not ignore any changes around your nipple area. If anything looks or feels different, get it checked immediately. Sign number 5 is persistent pain in the breast or armpit area. Now, most breast pain is not cancer. Breast pain is very common, especially before periods, and is usually hormonal. But there is a type of pain you should not ignore, and that is pain that stays in one specific spot, does not go away after your period, gets worse over time, or is accompanied by a lump or any other symptom I mentioned. Also, pay attention to pain or swelling in your armpit area. Because your lymph nodes are in your armpit, and if cancer spreads, the lymph nodes can become swollen and painful. So if you have a persistent ache or tenderness in your armpit that doesn't go away, please mention it to your doctor. Remember, it's always better to get checked and be told everything is fine than to wait and let something serious go undetected. Now, ladies, I want to teach you how to do a quick self-examination at home. Step 1. Stand in front of a mirror with your arms by your side. Look at both breasts, check for any visible changes in shape, size, or skin. Step 2. Raise both arms above your head. Look again for any changes. Step 3. Lie down flat. Use your right hand to feel your left breast using small circular movements. Cover the entire breast, including up to the armpit. Then swap sides. Step 4. Check your nipples. Gently squeeze each nipple and check for any discharge. Do this every month a few days after your period ends. And if you are over 50 inches the UK, you will be invited for a mammogram every 3 years on the NHS. Please do not skip this appointment. It could save your life. So let's quickly recap the 5 early signs of breast cancer. Number 1. A new lump in the breast or armpit. Number 2. Changes in breast shape or size. Number 3. Skin changes, dimpling or redness. Number 4. Nipple changes or discharge. Number 5. Persistent pain in breast or armpit. Ladies, please do your monthly self-check. And remember, if you notice anything unusual, go to your GP straight away. Don't wait. Don't Google. Just go. This video is for information purposes only. Always consult your doctor for proper medical advice. If this video helped you, please give it a thumbs up and share it with every woman you know. Subscribe to Healthy Her for more important women's health videos every week. Together, we can keep each other healthy and informed. Take care, ladies. I'll see you in the next one.